one of the things that we've been discussing about what palliative care is, which is a perennial question among people working in palliative care, it ranges from palliative care is just good medicine. Medicine that's practiced well and compassionately. And this is a position I subscribe to. But that's not the only thing. It is also about, it is an area of medical practice where we concentrate on people with life-threatening illness, and including people towards the end of their lives. And it's about whole person care. It means a person is a physical being, also an emotional being, and a spiritual being. And so we look at all those different aspects of care. Well, I started in palliative care as a volunteer because I thought it was a good idea. I chose this area of medicine because it allowed me to practice medicine as I was taught as a medical student, the whole person care. And what I saw by the time I was ready to specialize was that people were looking at different parts of the body. Someone termed it as people were partialists rather than whole person care. So I chose to come into palliative care, and I've sort of grown with the field. I started off as a volunteer, starting off a home care service in Singapore. From there, I moved into one of our inpatient hospices when they were looking for a medical director. So I ran an inpatient service together with a home care service and a daycare service for about 5 years. And then when the opportunity came that I could start a new department in our National Cancer Centre, I grabbed that opportunity because I knew that we had to get into the mainstream medicine. Before we were in charities, and it was not accepted. It was sort of an add-on. It was something extra. The other reason why we had to get into mainstream medicine was because we could not renew ourselves. Young doctors weren't coming in and choosing to do palliative care. So I knew that we had to go into mainstream and get ourselves registered as a medical specialty so that we can compete for the young people and the young talent that's coming up. So after joining the National Cancer Centre, which allowed me to start a palliative care consult service at Singapore General Hospital, which is our largest hospital, after about 6 years, we were able to get palliative medicine recognised as a subspecialty of medicine. And we also, now in Singapore, every single public sector hospital has got a palliative care service. So we have managed to get it mainstreamed. And yet most of the people who are being cared for in Singapore are still under home care. So we continue to run, there are now 9 charities that run home care services, and those are well coordinated with the hospital services, and we have 3 inpatient services as well. Well, in Singapore, we have one of the most rapidly aging populations in the world. And so the government is very worried about who are going to be the future caregivers. So in this conference, I learned quite a lot about, other people's worries about the same thing. And while our home care service is fairly well developed, we know that we're getting to the stage where home caregivers are going to be less and less prevalent. Already Singapore relies on a lot of domestic helpers, foreign domestic helpers, but that situation may or may not last. So the government is looking into inpatient services, long-term care. So the whole thing about providing palliative care in nursing homes and long-term care facilities is something that we're looking into very seriously.